Good evening. A critical milestone was reached overnight in the government's bid to overhaul the nation's health care system. Today, the president and many of his fellow Democrats are celebrating last night's passage of the House of a health care reform bill. The plan is meant to extend coverage to millions of uninsured Americans, but the health care battle is far from over. With the House on board, all roads to a final bill now lead to the U.S. Senate. That guarantees a lot more give and take ahead. For more, let's go to NBC's Mike Vaquera at the White House. Mike?
Good evening, Lester. It was a long day, but a big victory for the president and congressional Democrats. Now they are pressing as the White House for a final bill agreement with the Senate before the end of the year.
The president today returning from an overnight trip to Camp David, after Democrats handed him a hard-fought victory last night in the House.
The yeas are 220. The nays are 215. The bill is passed.
In a marathon debate that featured theater,
Maddie wants patient choice. Maddie doesn't want her mom's premiums to go up.
Plenty of partisan bickering.
Mr. Speaker, I ask unanimous consent that my remarks to revise my remarks in support of reform that ensures that no mother will ever have.
But also solemn talk of the proper role of government in health care, both for
and it sees to it that when you go to bed at night, you're going to wake up knowing in the morning that you're going to have health insurance.
And against.
I'm not going to put my kids further in debt. I'm not going to dim the lights of freedom for my kids and theirs, nor anyone in this country if I can avoid it.
In the end, the bill passed by 3 votes, with 39 Democrats, mostly rural conservatives, voting nay. Only one Republican, Representative Joseph Gao of New Orleans, was in favor. Today in the Rose Garden, the president praised those who stuck with him.
Given the heated and often misleading rhetoric surrounding this legislation, I know that this was a courageous vote for many members of Congress.
The bill would require all Americans to get health insurance, require most large businesses to offer a plan to employees, prohibit denial based on pre-existing conditions, extend coverage to an estimated 96% of Americans, bar the use of federal funds for abortions, and create a public option. The cost? $1.2 trillion, paid for with a surtax on couples making more than $1 million annually, and cuts to the growth of Medicare. Now it's the Senate's turn, where the stance of independent Joe Lieberman threatens prospects for the issue most dear to Democrats.
If the public option plan is in there, as a matter of conscience, I will not allow this bill to come to a final vote.
And Lester, it's important to point out that though the president cleared a big hurdle in the House last night, an even bigger one looms in the Senate, where there's not only disagreement with the House on the issue of the public option, but on how to pay for all of it. Lester?
Mike Vaquera, thank you. We've asked CNBC's chief Washington correspondent John Harwood to join us tonight to help us understand some of the key points of this bill. John, no matter what the final version of this bill or any bill looks like, it's going to likely force uninsured people to sign on to a health insurance plan. Isn't that going to essentially cost them money or even penalize them if they choose not to? How exactly will it work?
Well, yes, it would, Lester. The idea, though, behind this individual mandate is that insurance works best when risk is shared among a lot of people. So the idea that Democrats want in both the House and Senate is to get everybody into the system, healthy people as well as not healthy people, and then the risk is spread and everyone gets a better shake in the end, especially the people who have difficulty getting insurance now.
We've been hearing the term public option since this debate really heated up over the summer. It's apparently in this bill that was approved here. Explain, put it in the context of how it would work, who would benefit from the public option.
Well, the public option, Lester, is designed for people who make too much money to qualify for Medicaid, the health insurance program in the poor, but don't work for employers who offer health insurance. So it's people who are sole proprietors, small business people, those who are trying to buy in the individual market. And for those people, the market through these exchanges and the public option may result in lower premiums than they now would have to pay if they're able to get insurance now.
Republicans have raised in opposition to all this, and polls show that a lot of people are concerned that their personal premiums might go up to pay for the uninsured. Are there protections against that in this House bill?
Well, it's a legitimate concern because for those people who now have insurance and are going to see their insurance companies be prohibited from denying coverage to those high-cost patients, some premiums could go up. The way they try to deal with that in this legislation is providing subsidies for people to protect them against premium increases, have health service delivery reforms they hope will bring down costs over the long run, and also through regulation try to prevent insurance companies from raising premiums too much.
John Harwood, we appreciate your insight. Thank you.